Thank you for joining us for continuous learning with Bioguard. In today's webinar, we are going to introduce how to use different diagnostic tests to identify infectious diseases in cats, especially in FeLV, FIV, and FIP. Before we start today's topic, let me briefly introduce myself. I'm Yung-Tsun Lo, or Robert. I'm graduate from Taiwan, National Taiwan University, and get a master's degree and got my veterinary license in Taiwan and my PhD degree from Mississippi State University. I got some patent and also co-authorized in a book. Before we start today's topic, I would like to invite you to scan the QR code on the PPT and following Bioguard, the Facebook and LinkedIn. We post lots of information, including knowledge base, product base in both LinkedIn and our FB. So let's start today's webinar. Speaking of diagnosis, most one will think about most one will know the rapid test. That's the most commonly applied diagnostic tool for infectious disease in clinic. For rapid tests, including detecting the antigen or detecting the antibody. So, but why some rapid tests detecting the antigen of the pathogen, some detecting the antibody? The issue is related to for detecting the antigen or detecting more related to the virus shedding or protein secretion, like in canine adenovirus, distemper virus, or coronavirus, canine coronavirus, parvovirus. Those are the virus. Those viruses can either shed from the feces or from the nasal secretion or ocular secretions. So it's easier for this kind of pathogen. It's easier to detect the antigen using the rapid test. For the Giardia, sometimes for Giardia or the FELV, it have the Giardia also detecting the protein, like FELV detect the P27 protein, or the heartworm in dog, it detecting the secreted protein from mature female heartworm. So those are easier to detect the antigen of those pathogens. But for some pathogen, like the blood parasite, include Babesia, Anaplasma, Ehrlichia, or Toxoplasma, those parasites is either they did not secrete those kind of protein that frequently, or they just like a Toxoplasma, they only shed the oocyst from the feces like for 7 to 10 days. And after that time, it cannot detect the oocyst from the feces. And sometimes they just even like Toxoplasma just hide, becoming the cyst, forming the tissue cyst and stay inside the tissue. And this, during this stage, there's no way to detect the toxoplasma using the antigen detection. Instead, detecting the antibody is easier, especially since there's no vaccine for toxoplasma gondii. So detect the antibody detection can also prove of the infection of the toxoplasma. And similar case for FIV. FIV infection, since most of the country don't allow the FIV vaccination, so detecting of FIV antibody usually means the infection of the FIV. Or sometimes, like in heartworm in cats, because unlike the heartworm in dogs, there are lots of adult heartworm in the dog. Instead, if cat infected with heartworm, sometimes there may be only 2, 3, or even 5, 6 heartworm become the adult and residue inside the heart. So and sometimes it's even only the single female or male heartworm exists. And in that case, it's not easy to detecting the secreted antigen from the mature female heartworm. So in case the heartworm, sometimes you can also find the rapid test detecting the antibody. Let's just to figure some elaborate how the antigen test and antibody test work. We are not going to go into the detail. I think after the COVID-19 pandemic, most of us are familiar with the antigen and antibody rapid test already. And in addition to rapid test, the PCR or real-time PCR are also widely applied for diagnosis in infectious disease in the clinic. Like PCR, including during the PCR, they usually need to send the sample to the reference lab, and the reference lab will running the PCR and then providing the testing result to the clinic. Or right nowadays, more and more real-time PCR, even including the in-clinic real-time PCR, are available on the market. And so it's using PCR, using the real-time PCR in clinic is more convenient nowadays. And Bioguard also offers in-clinic real-time PCR for in-clinic infectious disease diagnosis. If you are interested, you can contact Bioguard after the webinar. So this table summarizes what's the difference between rapid test, antigen, antibody detection, and PCR. For PCR, actually PCR test is detecting the genetic material, DNA or RNA. Is depending on if it's bacteria, parasite detecting or DNA virus will detect the DNA. If it's RNA virus like coronavirus, it detect the RNA from the sample. It will tell you if the individual has an active or the current infection. For antigen test of rapid test, it detects the pieces of protein, or that's what we call the antigen in the sample. And it also tells you if the individual have an active or current infection. And for antibody test, it detects the antibody produced by the animal. Those antibodies are produced against a specific pathogen. So it can only tell us if the individual have a previous infection, but it cannot tell us if the animal is still in infection or is already recovered from the past infection, because the antibody, especially IgG, will stay for some time. Like in Babesia gibsoni, some study already indicate the IgG antibody against Babesia gibsoni can stay, or other Babesia canis, it can stay inside those blood vessels up to a year. So for antibody tests can only tell us the animal have been exposed or infected with the pathogen previous. And another issue is does the positive result means infection, negative results means no infection? For antigen or PCR test, as we mentioned in previous slide, it represents the current infection or the active infection. Sometimes there may be false negative because like in the very early stage or very late stage, if there's not enough antigen in the specimen, it will produce the false negative result. Like the FeLV infection. FeLV infection, it detects the P27 protein from the FeLV. However, the P27 protein can only be detected about 1 month after the cat is exposed to the FeLV virus or being infected with FeLV virus. Before that, there's not enough P27 can be detected. Or for the medication can also affect the test result, make it false negative. That's especially for bacterial infection and parasite infection like Anaplasma, Babesia, all those stuff. If we collecting the sample after the antibiotic treatment and then send it to the lab for PCR, and usually you will get a negative result. That's the false negative result. So better to collect the sample before the treatment, any treatment of medication. Or the FeLV, we just mentioned, the P27 protein can only be detected about 1 month after the FeLV infection. And for antibody test, it can only tell us the infection, the animal have been infected with the pathogen before, but it cannot tell the time of infection. And so we will not know is the current infection or is already recovered. And also, the antibody produced by vaccine or infection most of the time cannot be differentiated. And the antibody are produced slowly compared to the antigen or compared to the PCR test. And some may also influenced by the maternal antibody, like the FIV antibody. If the queen have the FIV infection, the kittens will also get the FIV, will also show FIV antibody positive after they got the cholesterol from the queen. So that's something we need to pay attention. So since every test have its advantage and disadvantage, so which test is better choice? There's actually no specific answer. because it actually depends on the what kind of disease you want to test. Like as we mentioned, we talked, if it's toxoplasma infection, detecting antibody is maybe a better option because the shedding of oocysts from feces only appear a short period of time. And for others, like virus infection, most of the time, for most of virus infection, using the PCR or antigen detection is a good option, except for FIV. FIV detect antigen is not good option. Detecting antibody is a better choice. But generally, for the infection, if we detect the nucleic acid like a PCR or the reverse transcription PCR, this detecting the RNA, usually is can detect the infection at the earliest time. And then is the antigen. And then is the antigen, rapid test, antigen test. And for antibody will show up even later. IgN will show up first, and then it's IgG antibody. So for detecting the IgG antibody, usually require 3 or even 4 weeks after the virus, the animal is infected with the pathogen. And for FIV antibody produced even slower, may take up to 2 months for FIV antibody to be able to be detected. Usually that's the common case. So now let's get into the FELV and FIV infection of diagnosis. For both FELV and FIV belong to the retrovirus. So the retrovirus is a very specific, very special virus. They can insert a copy of their RNA genome because they make their RNA genome into the DNA and then integrate that DNA into the host cell DNA. So there are two important features for the retrovirus. The first one is they produce DNA from their RNA genome. That's what we call the reverse or the retro here. The retro means the reverse because usually it's from DNA become the RNA, but retrovirus is a special case. They produce DNA from the RNA. And then the new DNA produced by the retrovirus, it will be incorporated into host cell genome, like here, we show here. By the integrase enzyme, and then it will stay maintained once it becomes the and also this is what we call the provirus stage, provirus status of the retrovirus infection. And once the infection success, the cat will never really fully recover from the FELV or FIV infection. It will just be infected for their whole lifetime. And let's check a retrovirus, closer look at retrovirus replication. Here we use the FELV as an example. So after the FELV virus bind to the receptor, it will enter into the infected cells. the target cells also usually is the lymphocyte. It will uncoating. Then the RNA part of the FeLV, the red circle spiral shape here is the RNA. The RNA will be reverse transcribed into the DNA by the reverse transcriptase of the FeLV virus. And then it will from single-strand DNA become the double-strand DNA. And the double-strand DNA will get into the nucleus of the infected cells and then be integrated into the host, the DNA or the chromosome of the host cells. And when the virus is under stress or activated, it will make the new messenger RNA and produce the protein of the virus. And then after assembling of the virus, it will be released outside the cells into the blood and also to the saliva. And at the same time, there are some free P27 antigen because they produce a lot of the protein. Some may not be assembled. So those P27 antigen will also be released into the blood circulation. And this P27 antigen are actually for the rapid test, antigen test, or the ELISA test, are detecting those free P27 antigen in the whole blood, serum, or plasma. So let's take another closer look at the FeLV. It belongs to the Retroviridae in genus of gamma retrovirus. And it have 3 subgroups. Actually, right now there are more than 3 subgroups, but most of them belong to these subgroups A, B, and C. It usually transmits through the direct contact, close contact through the saliva, like grooming. And usually kittens are at higher risk. And for adult cats are more resistant to the FeLV infection. And that's the virus structure of the FeLV. We can see in the envelope, it's the envelope virus. So on the envelope, it have the surface protein, the GP70. That's usually if you are using the recombinant subunit vaccine for FeLV injection, it usually composes the GP70, the surface of the envelope protein for the FeLV vaccine. And it also has a transmembrane. And the caps inside the virus, the capsid P27, that's what we just mentioned. The rapid test and ELISA actually detecting the free P27 protein in the blood. And also inside have a nuclear capsid protein. So for FeLV subgroup, the FeLV is the most common subgroup of the FeLV virus. It is transmitted between the cats, and it can induce immunosuppression and other FeLV associated diseases like lymphoma or other issues. And for FeLV, it's actually a recombination between the FeLV and endogenous FeLV. What does this mean is the cat must infect with FeLV subgroup A first, And the FeLV-A will recombinate, will have a homologous recombination with the endogenous FeLV, and then it become the FeLV subgroup B. And for it can cause the hematopoietic neoplasia. And for FeLV-C, the subgroup C is actually the FeLV is also originally come from the FeLV subgroup A. The cat, once the cat infect with FeLV subgroup A, the AMP gene of the FeLV-A will make, because of like the sedation pressure, it will undergo some mutation, and then those mutations in AMP gene will make the FeLV-A subgroup become the FeLV-C, and it will cause the non-regenerative anemia. So, although there are 3 subgroups of FeLV virus, it's all starting from the FeLV-A. And the transmission we just mentioned previously is mainly through the close contact, especially like a mutual grooming because of the saliva exchange. And although biting is not the main transmission route, but biting may still cause the transmission. And of course, blood transfusion also. And the queens to their kittens may also cause, because for vertically transmission also occurs because by the placenta or during the nursing may also cause the transmission. And it's mainly through the oral nasal route get into the new host. So what's the outcomes of the FeLV exposure? Here we use the exposure because the exposure here means it's different from the infection. If the cat is exposed to the FeLV virus, it doesn't mean it will definitely get the FeLV infection. So here, let's take a look. Once the cat is exposed to the FeLV, if the cat have an early and strong immune response, like a cat already get the vaccination and is in good health situation, it will produce very strong immune response and then get rid of those viruses. So the cat will maybe exposed to the FeLV virus, but those viruses will never infect the cells in oropharynx or tonsil. That's what we call an abortive infection. That means there's actually no virus replication. And however, if the cat doesn't have that early strong immune response, the virus, FeLV virus, will infect the cells in oropharynx and tonsil. And once it infects the lymphocyte inside the tonsil, it will produce the primary viremia in the because of the infection from lymphocyte monocyte. And those primary viremia will bring those virus, FeLV virus, to other lymphoid tissue. And if the cat has a late immune response, although it's not that good, not as good as early strong immune response, it will produce the late immune response and then make the virus not get into the bone marrow And that's what we call the regressive infection. But at this time, it only shows the transient viremia, and it will not affect the bone marrow. And if unfortunately, if the immune status of the cat is very poor or no immune response, then those FeLV will infect from the lymphoid tissue and produce the secondary viremia and then get into the bone marrow and then affect the hematopoietic precursors. And after that, that's what we call progressive infection. At this stage, the prognosis is very bad for the cat. It will show continuous viremia and also affecting the bone marrow. So let's get into the abortive infection, because we say, because after the FeLV exposure, the cat will produce the neutralized antibody and then just block the infection of the FeLV. So at this stage, the plasma virus RNA will be negative. Provirus DNA, the PCR. For the plasma virus RNA need to be detected by reverse transcription PCR. Provirus DNA is detected by the PCR. And P27 capsid antigen will also be negative because there's no virus replication at all. And at this stage, only detecting the FeLV antibody like a P15 envelope protein or the surface of GP70 can show us the cat have been exposed to the FeLV previous. And this stage of the cat is actually more common than expected. Based on a study, 4 to 11% of the cats in Germany and Australia actually belong to the abortive infection. And for regressive infection, because if the cat don't have a good enough immune response, so there's no early neutralized antibody to block the infection of the virus. So it will infect the oropharynx and tonsil, producing the first viremia. And then the virus particle will get through the blood into other lymphoid tissue, and then it will have a later immune response. At this stage, those antibody will clear the viremia stage. By that time, the virus already caused the infection. It will remain provirus stage in the infected test. So at that time, if we do the test, the provirus DNA will be positive. And for the virus RNA will be just transient plasma RNA positive, and P27 protein is similar, only transient, because for P27 protein, it requires 1 month after the exposure. And then after 12 to 16 weeks after the infection, the P27 protein and the plasma virus RNA will disappear again. So that's why we call transient plasma virus RNA positive and transient P27 antigenemia. And this stage of cat usually about 1 to 2% in the study in Germany and Australia. And if for cat in the very poor immune status, there is no immunity at all. So it gets into the lymphoid tissue, it will produce the secondary viremia, and those virus will then get embedded into the bone marrow and infect the hematopoietic precursors. to destroy all those blood cells. So at this time, at this stage of infection, you cannot detect antibody. And for the plasma virus RNA, Provirus DNA, and P27 antigen will all show positive for all those tests. And this is on stand for 0.5 to 2% of cats in previous study. So for the FeLV diagnosis, we can see it's including the serology, like ELISA, to detect the FeLV specific antibody. This usually only can be done in reference lab, or using the point of care test, like a rapid test or ELISA test. You can detect the FeLV specific antigen, the P27, and PCR detect the the FeLV. This should be the FeLV Provirus DNA. And for RT-PCR, detecting the virus RNA. And also virus isolation can using the blood to isolate and control the FeLV variant. And that's the outcome of FeLV outcomes and diagnosis summary. So for abortive infection, there's no virus shedding, also no related disease. It can detect FeLV antibody and no P27 antigen, no Provirus DNA, no plasma viral RNA, and no visible virus, also no related disease. For regressive infection, no virus shedding. It rarely causes the FeLV associated disease, and the FeLV antibody positive, P27 antigen and plasma virus RNA will be transient positive. The Provirus DNA will be positive. And visible virus is negative because no viremia. And for progressive infection, the virus shedding, of course, yes. And it's common to see the FeLV associated diseases. The FeLV antibody will be negative because they cannot produce antibody anymore. And for P27 antigen, Provirus DNA, plasma virus RNA will also show positive and also can see the visible virus. And as for prevention of FeLV, usually just preventing the exposure is the best way. And then early identification of FeLV infected cats and isolate them also important. And vaccination also work. Is recommended for all at-risk cats. It can reduce the risk of FeLV infection, but of course, it cannot 100% protect those cats vaccinated with the FeLV vaccine. It can reduce the risk of the infection. And also, make the FeLV test before vaccination is also recommended, because once the cat infected with the FeLV, there's no need for the FeLV vaccination, because the FeLV vaccine won't work for those FeLV infected cats. And then let's take a look at the FIV. FIV also is the Retroviruses family, but it's a different genus. It's in lentivirus genus. It's similar to the human immunodeficiency virus, the HIV. They are highly similar. And there are 6 classes of FIV from A to F, and also the recombinant between A and B, A and C, or A, B, C, also have been reported. And it also through the direct transmission, especially through the fighting, biting, and for outdoor intact male, it's 2 to 4 times higher risk. And that's the FIV global distribution, like in North America, A, B, C, and recombination between A, B, A, C have been reported. In South America, class B and E, and in Europe, A, B, and in Japan, A, B, C, D, and in Thailand, C, and in Vietnam, D, and in Australia, class A, and in New Zealand, A, C, and F, and even combination of AC and then special clade also been reported. The transmission we just is mainly through the bite worm. It's unlike the FeLV. FeLV can just go through the close contact, like a mutual grooming, but FIV usually needs through the bite worm. The vertical transmission is uncommon in naturally infected cats. And this figure just is show the natural history of the FIV infection, and we can see the black line here is the CD4 T cell. CD4 T cell is the main target for the FIV infection. Once the cat infected with the CD4 T cells, with the FIV, the CD4 T cell will starting to drop. You can see the line here. And CD8 T cell is another, this CD8 T cell actually is related to the cellular immunity. So the CD8 T cell would increase, starting to increase. And then as the increase of the CD8 T cell and the antibody, the green line here, the antibody of FIV, and then we'll make the FIV virus particle, here, the orange dot, from starting to increase to drop. Once it drops to the lowest point, that's what we call a virus set point. It will getting into the asymptomatic phase. In the asymptomatic phase, the CD4 and CD8 and antibody will just maintain in the peak, but gradually drop. Once they drop to a point, then the virus will start to increase again in the blood vessel, and that's what we call the terminal stage or terminal phase of the FIV infection. So for FIV diagnosis, it usually can use the serology, including the ELISA, Western blot, or IFA, and can detect the FIV specific antibody. And for rapid test, also rapid test can also detect the FIV antibody. The PCR detecting the FIV provider DNA, RT-PCR detect the virus RNA. And for virus isolation, of course, using the blood can also isolate, capture the FIV variant. So for FIV antibody test, is because the infected cats usually develop high concentration of FIV specific antibody. And the FIV usually always produce a persistent infection, and the cat do not recover. So detection of the antibody is generally indicative of FIV infection. And this Western blot is actually a gold standard diagnostic test. But of course, this cannot be used in the clinical. It need to be performed in reference lab. And the PCR or RT-PCR detecting providers DNA or virus RNA. And some infected PCR is actually PCR, RT-PCR quite sensitive method, but sometimes some infected cats are not detected by PCR. It's likely because of the virus sequence variation or low virus load. So since we introduced those diagnoses of FeLV and FIV, so when should a cat test for infection of FeLV or FIV? It's usually suggested as soon as possible after the cats are acquired by the owner. And some need to pay attention. The FeLV P27 antigen, that's for rapid test, it can show up 1 month after the infection. For reverse transcription PCR, it was much earlier, usually 1 week after FeLV exposure, but sometimes may take 2 or 3 weeks. For PCR, to detect the provider DNA, usually can be detected. Those provider DNA can be detected 2 weeks after FeLV infection. And for FIV antibody test, it requires 2 months post-infection. So that means after the cat is infected with FIV, it takes 2 months for the antibody to produce enough antibody to be detected. And also, if the queen, the mother cat, have an FIV infection or have a vaccination against the FIV, those maternal FIV antibody will be transferred into the kitten. So for kitten younger than 6 months old, if it detects the FIV antibody show positive reaction, better to redo it again after the kittens are at least 6 months old. And also prior to vaccination against FeLV or FIV, because if the cat have FeLV infection, the FeLV vaccine is useless, cannot protect the cat anymore. So no need for the FeLV vaccination. Similar case for FIV vaccination. And of course, if the cat have a potential exposure to infected cats, like the indoor cats run to the outdoors and contact with other cats with unknown status of the FIV, FeLV infection, and better to do the test, but need to pay attention. Remember, the FeLV P27 antigen take 1 month. FIV antibody take 2 months to develop. And whenever the clinical illness occurs. So for FIV prevention, of course, similar to the FeLV, just preventing the exposure. And if the cat have FIV infection, need to be identified and isolated, prevent them to transmit the disease to other cats. And although there's a vaccine available, because the vaccination may make the FIV diagnosis more complicated. So, and also the protection efficiency is sometimes is undoubted. So most countries there's no FIV vaccine on the market. So that's the AAFP suggestion for diagnostic for FeLV and FIV. They suggest the level 1 diagnostic. That's usually in clinical. If it's FIV positive or FeLV positive, then for the both or negative, usually would suggest to do another test unless the cat status is very clear. You have a clear history signal and the symptom is very obvious. Otherwise, would suggest to do another diagnostic. Do not just judge a cat with the FeLV or FIV infection, just simply based on a single test. And this is another diagnostic tool for ABCD FeLV. We just put here for your references. And for FIV, they also have a very clear suggestion for the FIV, how to diagnose it if the cat have FIV infection. So let's make a summary for the rapid test of FeLV and FIV infection. Since the rapid test is very commonly used diagnostic tool for FeLV and FIV diagnosis in clinic. For FeLV, it detects the P27 antigen, and it usually need 30 days post-infection. If it's positive, that means the cat is in progressive infection. And also, we may suggest to retest it again in 12 weeks because some of the cats, the P27 antigen would become negative if it's regressive infection because the P27 antigen will disappear. If it's negative, if the cat is not exposed, recently infected, if it's negative, means it's not exposed or it's recently infected, and the P27 protein still not be detected, still not detectable, or maybe it's in regressive infection. So it suggests for the high-risk cat, then suggests to repeat in 1 month, especially for those recently infected cats. And of course, it may be the confirmation of the FeLV negative. And for FIV antibody, it requires 2 months post-infection to be able to be detected. If it's positive, need to pay attention. If the kitten is younger than 6 months, need to check if it's from the maternal antibody. If it's because of the queen have the infection, better to repeat the FIV antibody test again after the kittens are at least 7 months of age. If it's negative, it's highly reliable. If the cat is high risk, can repeat in 2 months. And then let's take a look at the Feline Coronavirus. There are 2 kinds of FCoV serotype. The serotype 1. The serotype 1 is the more prevalent serotype. is account for 80 to 95% of FCoV infection. For serotype 2, although it's less prevalent, but based on some study that suggests serotype 2 is a more virulent serotype. And the serotype 2 is actually a close species recombination between FCoV serotype 1 and canine coronavirus 2. So the difference between the serotype 1 FCoV and serotype 2 FCoV is mainly on the spike protein and the surrounding gene of the FCoV genome. And others are all the same. FCoV also, in addition to 2 serotypes, it also has the 2 biotypes, or what we can also sometimes say the pathotype, the FECV. FECV is the stand for Feline Infectious Coronavirus. That's a less virulent FCoV. And the other one is the FIPV, the Feline Infectious Peritonitis Virus. It can cause the FIP. And the relationship between FECV and FIPV is once the cat, usually in the environment, the cat infects the FECV. And if once the cat infects FECV, if it cannot get rid of the FECV from their body, those FECV will keep mutation inside cat's body. And that's what we call the internal mutation, and then become the FIPV. So this table summarizes the comparison between FECV and FIPV. The FECV causes the viral enteritis, or sometimes it's even a symptomatic symptom here. So for multi-cat environment, as high as 80 to 90% of cats may have been infected with FECV, and single cat household is up to 25%. And it's mainly through the fecal-oral route to transmit. The severity is usually mild or even symptomatic. And for FIPV, 5% to 12% of FECV infected cat I cannot say only, because once it becomes the FIPV, it's usually fatal. So, and it infects the monocyte or macrophage, because after the internal mutation, the cell tropism is from the epithelium of the small intestine for FECV become the monocyte or macrophage for the FIPV. And it causes the vasculitis or granuloma lesion. That's what we also call wet and or dry form FIP. So the transmission is through the internal mutation of infected FECV, and it's fatal. Let's just summarize. Figure show how the cat, this is the cat usually get infected with the FECV, and most of the cat will recover from the FECV infection. However, some cat cannot recover from the FECV mutation, and those FECV will keep mutate inside the infected cats. That's what we call the internal mutation. And about 5 to 12% of cat will become the FIPV. And for diagnosis of the FIPV, actually there's no single test can do the definitive diagnosis for FIP. Usually it requires a combination of the signal and history, clinical sign, hematology, imaging, failure also usually suggest using the effusion or do the Rivalta test and the RT-PCR or even the immunohistochemistry or immunofluorescence with combination of all those diagnosis tools can help the best to diagnose the FIP. And for the measure of antibody, although there's some FIP, although there are some rapid tests can detect the antibody against FCoV, but there's no FIP specific antibody test. So most FCoV and also most FCoV antibody positive cats never develop FIP because we say about 5 to 12% of FECV infected cat will become the FIP. So most of cat will not develop into FIP. And for FCoV antigen rapid test, same thing. It's not a FIP specific antigen test. It can only tell you if the cat have FCoV infection, and because using the feces, so it can tell you if the cat is shedding the FCoV virus. And of course, it's still useful because if in a multi-cat household, if they want to introduce a new cat, can make sure the new cat is not shedding the FCoV virus before they introduce the cat into the new household. And for the best tool to diagnose the FIP is the effusion, granular or abdominal effusion. Usually, the effusion is clear, viscous or sticky, and straw yellow in color, and have a high protein concentration. And the especially useful information is the albumin to globulin ratio. If the AG ratio is less than 0.4, it have a very high positive predictive value for FIP diagnosis. And another commonly used test in clinic is the Rivalta test. It's simple, inexpensive. It mainly differentiate between effusion, but the effusion caused by FIP and effusion caused by other disease in cats. So it's differentiated between a transudate from the exudate. So it's also simple, just one drop of effusion fluid here the top of the test reagent. If it's negative, the drop here and the solution will remain clear. If it's positive, retains its shape, stay attached to the surface, or just slowly flow down to the bottom of the tube. It's like a drop or jellyfish, just like the figure here. And if the test result is positive, in addition to FIP, the lymphoma or bacterial peritonitis will also make this test positive. So if the Rivalta test is positive, we can rule out the lymphoma and bacterial infection by cytology for lymphoma rule out, bacterial culture for bacterial infection rule out. And the most useful result is if the test result is negative, then they will tell us is FIP is highly unlikely for this cat because the negative predictive value up to 93%. Another common use test is the reverse transcription PCR or the RT-qPCR. The advantage of using the real-time the reverse transcription real-time PCR is very quick and also very highly sensitive. And the sample can be applied for the reverse transcription PCR, including the pleural abdominal effusion. That's especially the case for wet form FIP. And if it's dry form, suspect of dry form FIP can use the affected tissue like the lymph node or the CSF or a Cracker's humor. And the test report we attach here is from a clinic in Turkey. They use the qMini real-time PCR series to detect the affected tissue. They use the ultrasound to do the to assist them to get the using the fine needle technique get the affected tissue and then do the real-time PCR and find the real-time PCR positive. And they also send for the immunohistochemistry and also show positive reaction. And if you use the blood, it can only tell you it's the viremia, but the viremia is usually not a very good indication. If using the feces, can tell you if the cat is shedding the virus. And if the cat have the FIP symptoms, and then the PCR from the effusion or from affected tissue is positive, that's very high indicative of the FIP infection. And that's also a detection method called the SG mutation analysis or FIPV biotyping. That's because we know the FIPV is derived from the mutated FECV. So it's early study, they try to identify what kind of mutation make the FECV become the FIPV. And they detect two mutations in the spike protein. You can see here. They think is highly related to the FIPV. And of course, this test can only work for type 1 FCoV, not for type 2, serotype 2 FCoV. And this test need to, when we interpret this SG mutation result, need to associate with other factors like a signalment and other test results to determine how likely the FIP is in the cat being tested. And for histopathology or immunohistochemistry, that's right now is considered the gold standard for diagnosis of FIP. That's just if they can detect the FCoV antigen in the lesion, area here, in the lesion area, inside the macrophage, and can say that it's we can diagnose this caused by the FIP. And although there are lots of treatment proposed, like antiviral chemotherapy or use the immunomodulators, but usually those are just make kind of relief of the symptom or make the cat have a better immunity against the FCoV infection, and usually actually the effectiveness is not good at all until the new antiviral drug like GC376 and even the GS441524, especially the GS441524 as a nucleoside analog, has already been proved in lots of different studies. Is very effective in treating cats infected with the FIP. And the GS441524 is actually related to the remdesivir, the GS5734. They are the same series of the medicine, and the remdesivir is a prodrug of the GS441524. The active part of the remdesivir is the GS441524. In addition to the GC376, there are also some medications like FeLV and nirmatrelvir. Those work as the protease in 3C protease inhibitor. It can inhibit the 3C protease to cleave the multiple protein of the coronavirus into the individual protein as a result to make the virus replication, to block the virus replication. And GS441524 and molnupiravir both are the nucleoside analog. They block the replicase of the FCoV, make it will not produce from the plus genomic RNA, and then block the FCoV replication. In conclusion of the diagnosis for FIP, including the RT-PCR, the sequencing for SG mutation, antibody detection, and detection of FCoV by the immunofluorescence or the immunohistochemistry, and using the different sample. Let's just a table summarize the previous study about the sensitivity and specificity for different tests using different tissue. And the gold standard, of course, is the immunohistochemistry in the affected tissue. So thank you for attending, for your attention.